Hello and welcome to Anatomy for the Knee. So in this video we're going to look at all the bones, bony landmarks, muscles, ligaments and various other soft tissues associated with the knee. So let's start easy with the bones. So here we have 4 bones associated with the knee. You have the tibia on the inside here of the lower leg and the fibula down the outside. You have the patella, which is a sesamoid bone, and then you have your femur, which is your upper leg bone. Okay, so now we've looked at the bones, let's have a little look at the bony landmarks. So we've already done the ankle end of the tibia and fibula, so we're only going to look at the knee end. So you have your head of fibula here, and that's the only one for the fib. The tibia, there's a couple, so you have the tibial tuberosity here, which is where your quadriceps attach. You have your tibial condyles, which are these 2 lumpy pieces here. So you have medial and lateral, so that's medial on the inside and lateral on the outside. You then have your tibial plateau, which is the flat part here, which is where your menisci sit. So you then have your patella, and you have your inferior pole and your superior pole. So this is a sesamoid bone, as I've already mentioned, which is fairly unique within the body. There's not many. And the idea of a sesamoid bone is it sits in the tendon of the muscle and just helps to guide the muscle so that the muscle becomes more effective and more functional. So that moves up and down in the groove here. So if we look at the femur next, you have your condyles. So like your tibial condyles, you have your femoral condyles. So you have your lateral condyle and your medial condyle. Then higher up you have your epicondyles. So you have your lateral and your medial epicondyles. The way I teach people to find these is just to put your hand either side of the leg and just slide your fingers down, and as you start to feel the bone splay out, you know you're getting to your epicondyles and then onto your condyles. The other thing to mention on the femur is the femoral groove here. And this is where the patella sits and slides. So the patella follows in this groove. And when you get misbalances in the muscle, what happens is the patella is pulled to one side or the other and can actually rub on these surfaces. The last thing to mention on Bob here is the linea aspera on the femur. So it's a line, I can't get him to turn his leg around unfortunately, but there's a line on the back of his leg here. When you're in the workshops, have a look at Bob. But there's a line here and it's a site of muscle attachment. So your quads, lateral and medial vastus lateralis, attach onto that line, the linea aspera. So that's all your bony landmarks associated with the knee. Next we're just going to have a quick look at the joints. So there's 3 joints here in the knee. So the one that everyone would think of as the knee joint is this one here, and that's between the femur and the tibia. So that's the tibiofemoral joint. Gives it away a little bit by its name. So this is a hinge joint and it's a synovial joint, and it allows you flexion and extension. Also we have a joint between the patella and the femur, so that's the patellofemoral joint. Again, it tells you where it is and what it is. So that's a nice easy one. And that's a gliding, synovial gliding joint. The last one here, and in its own joint capsule, is between the fibula and the tibia. So this is the tibiofibular joint. So that's the little one there, and it just allows a little bit of movement here. So that's the 3 joints of the knee that you need to be aware of. Next we're going to have a look at the ligaments of the knee. So there's 4 main ones we want to talk about, and you've probably heard of some if not all of them. So you have your medial collateral ligament known as MCL, your lateral collateral ligament known as LCL, your anterior cruciate ligament known as ACL, and your posterior cruciate ligament known as PCL. So let's just locate them in the knee and talk a little bit about them. So the medial collateral ligament is on the medial border of the knee, and it comes from the tibia here onto the femur here, and it's a strap-like ligament. and it's here, and its role is to prevent forces that come this way. So as you can imagine, this is a highly damaged ligament purely because a lot of tackles and things come in this direction. So that's your medial collateral ligament on that side. On this side we have your lateral collateral ligament, and again it comes from the femur and on to the head of the fibula. And this is more cord-like, so it's a smaller ligament, and it doesn't need to work so hard as the medial one, purely because you very rarely get forces in this direction. So this is far less damaged than, say, the medial one. So that's your two main ones on the outside here. So medial collateral ligament on the medial border and lateral collateral ligament on the lateral border. Now within the knee itself, within the capsule of the knee, you have two ligaments, your anterior cruciate ligament and your posterior cruciate ligament. So your anterior cruciate ligament starts on the anterior plateau of the tibia here, or around here somewhere, and it goes up, back and laterally onto the lateral condyle of the femur. So it's kind of this direction. The posterior cruciate ligament starts posteriorly, so they tell you where they start to give you a clue. So the posterior cruciate ligament starts on the posterior surface of the tibial plateau here, and this one goes medially upwards and forwards, and it comes onto the condyle here. So the idea of the anterior and posterior cruciate ligaments is to prevent forward and backward motion of the lower leg, so that these two don't get shunted back and forth. So you can imagine again, probably more likely anterior cruciate ligament damage, and other reasons why anterior cruciate ligament is often damaged, because of the way the forces work during contact sports mainly. So that's your four main ligaments of the knee, and the four you need to know. So medial collateral ligament, lateral collateral ligament, anterior cruciate ligament and posterior cruciate ligament. So next I want to have a quick chat about some of the bursas of the knee, and as you can imagine there's quite a lot. There's about 14 I think, but we're going to look at 6 of them today. So they kind of tell you where they are, which is helpful. So you've got the suprapatellar, which sits up here, and that's between the femur and the quadricep tendon, so it protects the quadricep tendon from the bone. You then have prepatellar, which sits on top of the knee, so between the skin and between the patella. That's a commonly irritated one, so carpet fitters these days, but it's generally called housemaid's knee, and it came from housemaids obviously used to kneel a lot. You then have 2 infrapatellas here. So you have a deep and a superficial. So the superficial is between the tendon that continues down here and the skin, and the deep one is between the tibia here and that same tendon, so just protecting that tendon always round. So that's those 4. You then have pes anserinus bursa, which sits here, and this one is underneath those 3 tendons that merge here, just protect them from the bone. So your hamstrings and one of the adductors that comes down into here are all protected from the bone underneath. The final one, and I'm going to get Bob to do a high kick here, just so we can get to it, is in the back of the knee, and it's a superficial one again. So that's the popliteal bursa, and that's between the skin and the popliteal muscle, so it's just in the back there. So that's the 6 bursas that we're interested in associated with the knee. So the next structure we're going to move on to is the menisci, which is 2 C-shaped pieces of fibrocartilage which sit on the tibial plateau just here. And they have quite a few functions. So first of all, they help to create a better sitting point for your femur, so you're much more stable through here. They help to protect the hyaline cartilage of both the femur and the tibia. They help to move the fluid around the joint and help to keep it lubricated. They're an important part of something called the locking home mechanism, which helps us to stand up. And they also help to improve weight bearing, so it helps to give much more even pressure through the joint. So the last structures we're going to look at associated with the knee are the muscles. And again, I'm not going to run through the origins and insertions, you have all your manuals for that, and there's separate videos on that. But what I'm going to do is just remind you which ones affect the knee. So the main movement, first of all, at the knee is flexion and extension. There is slight rotation laterally and medially for the tibia, but really you're thinking about flexion and extension. So your main muscles here are going to be the quadriceps groups. You've got vastus medialis, intermedius and lateralis. You've got rectus femoris, which comes over the top. You then have your 3 hamstrings. So you have semitendinosus, semimembranosus, and then on the lateral border biceps femoris. You also have sartorius, which sweeps across from the hip to the medial side of the knee, so that's going to be a bit of a rotator because it helps with crossing the legs. In the lower leg you are going to have gastrocnemius as your main one, but also plantaris. And in the back of the knee you have popliteus. Then the last one to consider is gracilis, which is one of your adductors down the inside of the leg. So that's the main muscles associated with the knee. Just before we finish with the knee, I'd like to look at something called the Q angle. So this angle is the angle between the acetabulum, which is here, which we'll talk about more when we do the hip, and the centre of the knee. So in everyone it's slightly different, but between men and women there's a bigger difference, and this is because women have wider hips than men. Obviously women have wider hips to aid in childbirth, and men don't need that excessive width. So the problem that creates is that the acetabulum moves further this way, which means your angle between your knee and your hip is greater. So this puts more pressure on the knee, and women are more likely to have knee problems because of this. So I think it's 3.5 times more women have knee problems than men. So it's just something to consider when you are looking at knees, especially in women, that it could actually be internal wear and tear purely because of this Q angle. So if somebody's got a big Q angle, obviously that doesn't mean that there's wear and tear in the knee, but it is something that you need to consider and think about, because obviously that increased pressure and uneven wear on the knee. So that's everything you need to know now for your knee, and you can move on and do the associated quiz with this section and then move on to your next topic.